Assalamu alaikum doctors. In this video I am discussing a video station that is about DDH, developmental dysplasia of the hip. So in this video we can find that is newborn. If come, then it will be Barlow test or Ortolani test doing, and if the child is some older, then it is a limping child with DD come. So DDH, it is a trundle and bar gait, and length of the leg is discrepancy present. So the limping child, the DD, we can keep like developmental dysplasia of infection, NAI, trauma, tumor, systemic illness, rickets, muscle dystrophy, metabolic cause, Duchenne muscular dystrophy, and GIA. According to age, first of all, 0 to 3 years, so we can keep DDH, trauma, NAI, septic arthritis, osteomyelitis. So DDH, trauma, NAI, septic arthritis, and osteomyelitis. 3 to 10 year, transient synovitis, irritable hip, septic arthritis, osteomyelitis, Perthes disease, reactive arthritis. 10 to 15 year, we are giving SUFI, septic arthritis, osteomyelitis, Perthes disease, trauma. And in all age group, NAI, testicular torsion in boys. So 0 to 3 years, we keeping DDH, which come on exams, DDH, osteomyelitis, septic arthritis. 3 to 10 year, it comes transient synovitis, reactive arthritis, irritable hip, septic arthritis, osteomyelitis, Perthes disease. Keep in mind Perthes disease. 10 year is older children, SUFI, septic arthritis, osteomyelitis, Perthes disease, and trauma. In all group, NAI, testicular torsion in boys. So what history we ask? OCD, what increase and decrease, unilateral or bilateral, any other joint affected. Any redness, hotness, painful limitation of movements or swelling. Any associated rash, fever, affection of weight or sleeping and activity. History of any trauma, travel, any pallor, lymph node swelling, increase in tummy size or bruises. Developmental history like cerebral palsy, Burton shuffler, and delayed walking. Nutritional history for rickets. Perinatal history, presentation, birth weight, gestational age, result of screening test for hip at birth and at 6 weeks, any chronic illness like sickle cell anemia, GIA, hemophilia, if boy, SSLE, and IBD, duration of the illness if delayed, suspecting NAI, family history of similar condition, family dynamics, and if it registered to the social services, social worker. So DDH, onset, course and durations, what make it better, what make it worse. Then we are going, it is a unilateral, bilateral, other joint affected or not, previously any trauma, fever, weight, activity, sleep, painful, painless, very important, septic arthritis. Before starting, the duration is very important. From birth, it is going DDH. If before any, fever, any loose motion, gastroenteritis, reactive arthritis, transient synovitis, irritable hip are going. So much painful septic arthritis, swelling, osteomyelitis also we keep. Then child developmental history, nutritional history for rickets, and birth history, that is presentation, birth weight, gestational age, result of screening of the hip, 6 week, any chronic illness because of sickle cell anemia, GIA, hemophilia, duration of the illness. These are family history of similar condition, very important, associated with rash, fever, any lymph node swelling, increase in tummy size. Okay, what examination we do for DDH? So examination are AVC and vitals, full measurement and plot on the appropriate centiles. Okay, full length of both leg for limb length discrepancy. So limb length discrepancy we do. Level of both knee while hips knee are flexed, that is Gallagher or Ellis sign. Remember Gallagher or Ellis sign. Gallagher or Ellis sign, limb length discrepancy. Full MSK examination including the back examination for asymmetry in skin creases, vertebral column abnormalities, level of the both hips, examination of the skin for any rashes, hair and nails, abdominal examination for hepatosplenomegaly, neonatal screening with Barlow and Ortolani test only in neonates and hair, not thereafter neurological examinations. So we understand the examination AVC vitals. Then we are doing MSK full examinations, Gallagher or Ellis signs, that is limb length discrepancy we are doing, flexing of the joint and measure that. Then abdomen examination about hepatosplenomegaly. These are the joint itself is swelling, that red color, everything. Examination of the skin, any rashes, abdomen examination, neonatal screening, Barlow and Ortolani test. We ask about that. So abnormal examination defined as difference in the leg length, asymmetry in the skin creases in the back. So asymmetry in the skin creases in the back and skin folds in the both lower limb. Knees are different levels when hips and knees bilaterally flexed, with the affected knee is shorter. So one knee is shorter, there is a crease in the back we notice. Okay, difficulty in abducting, hip in 90 degree. Palpate the clunk when undertaking the Ortolani or Barlow maneuver. Investigation according to the age of the child in the video. In neonatal hip screening, all babies are offered by the age of 72 hours. So we know that 2 days, 8 days, and 6 weeks we do offer. Screening questions, what are we do for DDH? First of all, F, remember. First degree, family history of first degree relative to DDH. Female, food delivery, that is breech presentation during pregnancy, food deformity, congenital calcineo valgus, fixed talus equivarus, fat baby, birth weight is more than 5 kg, few lycor, oligohydramnios, few baby, multiple pregnancy, firstborn prematurity, fetal anomaly, neuromuscular disorder, congenital torticollis, congenital plagiocephaly. Clinical test, ortolani and Barlow test detect an unstable hip or hip that is disclosed or subluxed but reducible, and if irreducible hip, limited abduction of the flexed hip. Screen negative, no risk factor on history and normal examinations, no further interventions needed. These babies will be rechecked at the age of 6 to 8 weeks. So day 2 and 6 to 8 weeks they will be rechecked. Screen positive risk factor, we do ultrasound. So at the birth we do first Barlow ortolani test. Then if it is making a sound, then we will do ultrasound after that. An older child we do the X-ray hip. So these are 3 investigation. Barlow ortolani if positive, ultrasound, and X-ray is the older child. And what is the management multidisciplinary team? I will involve consultant pediatrician, orthopedic, rheumatology, physiotherapy lies with the school, family counseling. So orthopedic, rheumatology, physiotherapy lies with school. Non-medical and surgical treatment. Prophylactic, we giving swaddling, double nappy till ortho input and pelvic harness more than or equal to 6 weeks. For double nappy for the newborn baby and the pelvic harness 6 weeks age. And surgical is dislocatable or dislocatable to urgent ortho consultation more than 3 months, close reduction, open reductions more than 2 years, same, and femoral shortening, osteotomy, acetobuloplasty. These are special shoe we can give. We give advice for partheniris, avoid heavy weight. This is about that. And so treatment we understand, newborn baby we are giving double diaper more than 3 months. We are giving pelvic harness. It's more than 3 months, 6 weeks. More than 6 weeks we are giving pelvic harness. And 3 months we are giving open or closed reduction. If more than 2 years, then open or closed reduction and femoral osteotomy. And the complication, what happened? Hip pain. Okay. Hip pain, early osteoarthritis. Hip pain, osteoarthritis, vascular necrosis of femoral head, coxa magna. That is asymmetrical circumferential enlargement and deformation of the femoral head and neck. So hip pain, osteoarthritis, avascular necrosis, coxa magna. These are the complications of DDH. Thank you.